It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. It is Friday, March the 16th. Another beautiful day here in Scottsdale. We're here in the 70s, and we're coming at you live from the Scottsdale Air Park, right here in Scottsdale, Arizona, on 105.3 FM, 1510 AM, and the World Wide Web at moneyradio1510.com. And if this is the first time you've tuned into our show is exactly as it sounds, Health Futures. It's about the future of healthcare and specifically about how our older adult population can live a healthier, happier life. And how do we put the show on? We bring extraordinary guests here to the show. And today is no different, and we're covering a really important subject matter. So I want to just cut right to it and introduce my guests here in the studio. I've got two doctors here with me. I've got Dr. Adrienne Forstner-Barthel, and if it's okay with you, Dr. Forstner-Barthel, can I call you Ariel, I think you said?
Yeah, that's fine.
And you have red hair just like the Little Mermaid?
Just like the mermaid even sing.
There you go. Ariel, welcome to the show.
Thanks for having me.
And just to your right and to my left is Dr. Tafazwa Makarawu.
That's right.
Very, very good.
Yes.
Perfect. And you and I talked before the show, and if it's okay with you, I'd like to call you Taffy.
That's fine.
All right, so I got Doctors Ariel and Taffy here in the studio. And what are we going to talk about today? It is March 16th, right smack dab, middle of the month of March. And this month is Colorectal Cancer Awareness Month. And I understand that it is probably one of the most preventable cancers that is out there. Is that correct?
Yeah, I think that is correct. In fact, most cancers, when we talk about cancers, we simply talk about trying to diagnose them early. Colorectal cancer is the one type of cancer that you can actually completely prevent by appropriate use of colonoscopies.
And colonoscopy is a procedure that I am sure lots of people don't look forward to. And we didn't have a chance to talk about this, but the prep is usually the part that people really don't like. But candidly, it's changed. I know that I recently had one within the last 2 years, and I had a prep kit, I think it was, rather than drinking the castor oil and all that other stuff that you used to have to drink. It was pretty less filling, and I spent less time in the bathroom, but it wasn't as bad as people make it out to be.
Yeah, I do. We reassure patients that there have been some advances in medical technology, and the PrEP is definitely one of those. There's still no way around it. You have to get completely cleaned out in order to be able to see everything as we're doing the procedure. But you no longer have to sit there and feel like your brains are ending up in your toilet as part of the process.
And there you go. And you know, it's interesting because, you know, as I said at the very beginning, this is one of the most preventable cancers, and all you have to do is go have a colonoscopy.
Right.
And as I understand it, and you shared with me before we started our show, if you're white, 50 years is a good demarcation, if you would, to begin your first screen. If you have family history and you are Caucasian, you should have it done earlier than that. If you got serious family history, then it's way earlier than that.
Right. And, you know, we can get more a little bit into those guidelines, but the recommendations are now anybody who isn't lily white, which most of us do have some sort of mixed heritage.
Yes,
but anybody who isn't lily white should start at 45. If you have family history, then 40 or sooner, depending on what age your relative had that at. There are certain certain specific disorders, genetic conditions where you might even start in your 20s. Those are rare, luckily. And then the current recommendation is if you are Caucasian lily white to start at 50, although honestly, a lot of us, when we talk about, we do see too many 50-year-olds with cancer. So we kind of recommend folks to just start getting screened in your 40s.
Fantastic. Get screened early and you can prevent it. And really, as I understand it, if you're having the procedure done and they see polyps or any other abnormalities, they can do stuff while they're having, meaning you guys can do stuff when you're in there doing the procedure, correct?
Absolutely. So that's the benefit of colonoscopy as opposed to some of the other screening modalities that are out there. The benefits that not only can you detect early cancers, but also the identification of polyps is important because it not only diagnoses and formally proves that they're benign or should I say harmless, but also it allows you to eliminate that risk by removing them early. Because we know there's a proportion of those polyps over time would eventually develop into cancer. So in other words, you're reducing the one's risk of developing a cancer by removing it.
And, under most procedures, typically you might have to come back to have like a biopsy done and stuff. And this, you're already there, so you can do that type of work while you're in there, I would imagine.
Exactly.
Right.
And the great thing about colonoscopy that we tell patients all the time is we're not just diagnosing whatever the issue is, we're actually treating it at the same time. And any polyps remove, if they turn out to be precancerous, which the burden of them are, unfortunately, then by removing those, we've actually prevented a cancer in that patient. And that just is an enormous peace of mind for patients.
And for me, I'm a very self-deprecating guy. I share all my stuff with our audience, and fortunately, knock on wood, I did get a fairly clean bill of health. Doctors, I was told to come back in 5 years, so I feel good about that. But my wife recently had one, and they told her 10. So, what's up with that?
Well,
so that really is based on what we know of polyps. We know that they take a period of time to grow. And so dependent on what they find at the time of colonoscopy, the recommendations vary. And this is really down to the specialist that did the procedure for you. What they find is that if you have a certain number of polyps at the time of the procedure, that is an indication of your your risk for forming more polyps in the future. So therefore, they call you back sooner to make sure that if you do form any polyps in the time in between you have colonoscopies, that they can be removed again before they develop into a full-blown issue. I guess in your wife's case, she probably had what we call a completely clean colon at the time, and so therefore on that basis, she would not require a repeat colonoscopy for 10 years. Because we're expecting that she probably wouldn't develop polyps in that time frame.
So, Dr. Taffe, I agree with you, but one of the things that I want to just share with you as well, and this was her comment back to me, and my comment is to both you and Ariel. Diet has to have something to do with it. My wife is, one of those people that really watches what she eats. She eats lots of fruits and lots of vegetables. She stays away from bacon. She tells me I need to stay away from bacon. I love bacon. But, I would imagine food and diet has to be a big contributor to these polyps and these abnormalities that you're seeing in colons.
Yeah, so it's interesting. There are a lot of studies out there back and forth and a lot of arguments over how much what we are able to do as human beings impacts the risk of forming polyps. There was a very interesting large study published last year to speak to your bacon-loving tendencies that unfortunately warned folks away from all smoked meat. So that includes bacon, that includes luncheon meats that are smoked, that includes smoked chicken, or all of us who have a smoker at home and love to smoke things and that, even fish.
I was going to ask you that. So,
Yeah.
I understand the stuff that's packaged, it's got preservatives in it and stuff.
Right.
But even if you smoke it at home in a smoker,
Yes.
not good.
Unfortunately not. We all love that flavor.
Yeah.
But the act of smoking the foods encourages it to release carcinogens. And again, it's just exposure. your wife may have better genetics, so she can withstand more exposure to the carcinogens, and you might not have strong ones. And so eating the same diet, she might not get a cancer, whereas you might. Unfortunately, the recommendation is simply for anybody at risk or anybody who's had cancer that they only have 1 to 2 servings a month, which broke my heart because I do have a family history of colon cancer, and I now have to stay away from bacon, which I adore.
1 to 2 servings a month, though.
1 to 2 servings a month. I can look forward to that.
Okay. And probably crispy isn't a good thing.
Probably not, but crispy just tastes so good.
Crunch is so good.
I know.
You know what? I know my wife Susie's listening, and I'm going to cut back on my bacon to at least 1 or 2 servings a month. I promise. It's hard to believe we're down our first segment. I've got so much more to talk to you doctors about. I mean, this, is, if I understand correctly, the number 2 leading cause of death, cancers.
That is correct.
Yes.
And it's right behind, what's number 1? Lung cancer. Okay, well, I want to get into that a little bit more in the second segment, but it's hard to believe we're down our first segment. You've been listening to Health Futures, Taking Stock in You, and I've got Drs. Taffy and Ariel here in the studio. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You, and I'm your host, Bob Roth, and we're on our second segment, and we're talking about Colorectal Cancer Awareness Month, and I got Dr. Taffy and Dr. Ariel here in the studio. Now, they're with Arizona Associated Surgeons. This surgical practice has been around since 2007, and Ariel's one of the longtime surgeons there. She joined the practice about a year after they started. And if you want to reach them, you can reach them at 602-993-2622. You have multiple offices across the valley, right?
That's correct.
So, you can be seen by one of their surgeons and one of their physicians in any one of their locations, but call that number. So in the first segment, we were talking about colorectal cancer. We learned that it's the number 2 cause of death. As it relates to cancers, lung is number 1, colorectal cancer is number 2. We talked about how it is one of the most preventable cancers that is out there. All you have to do is get screened. We talked about the fact that you have to go through a colonoscopy. And we talked about the prep. And, the prep used to be a little bit more... let's put it this way, unpleasant, and it's still not one of the most pleasant things, but they have simplified it with new technological advances. And really, the prep consists of a day of cleansing, and it's followed by the next day of a procedure, and then you're done. And then the other thing that we learned in the first segment is that when these 2 fine surgeons are going and doing, not surgery, but when they're doing colonoscopies, if they see something, they grab it and biopsy it. If they see something that needs fixing, so to speak, they can take care of it there because they have all the instruments and tools to be able to do all of that for you as the patient. So I want to get into this a little bit more because obviously we know that the gold standard is to get a colonoscopy. And I'm telling our listening audience, do not listen to your friends complaining. Do not listen to them about how late they were up the night before and how they were on the commode, the toilet, the can, or whatever you want to call it, till they sweated it all out. It's not that bad. And when you think of the consequence, it's really not that bad if you do the testing. So, I want to get into with you fine doctors is if you haven't done the testing, but what are some of the symptoms that you might be having as a patient that might be suffering from potentially colon cancer?
So we always say that this actually is a silent cancer because a lot of times, unfortunately, there are no symptoms. But symptoms that always make us concerned are changes in the bowel habits more than just a day or two. All of a sudden, weeks of diarrhea or weeks of constipation, new abdominal pain, weight loss that can't be explained, although that tends to be a later stage. Any bleeding that's happening. We always say bleeding is not always hemorrhoids. Please get checked. It could be a colorectal cancer. It could be an anal cancer as well, which we also do help treat patients for. But a lot of times it also can be silent.
Yeah, in actual fact, I'll throw some figures out here just, I guess, to put it in context. In actual fact, patients that are diagnosed with colon cancer, only 1 in 3 have any symptoms. In other words, a big proportion of them do not have symptoms.
Wow.
So what that means is that, this is what speaks to the role of colonoscopy in all of this. When patients have a diagnosed cancer, a lot of the time these are actually picked up with colonoscopy. And so in actual fact, what we found, especially with the downward trend in the incidence of colon cancer over the years, one of the contributors, in addition to other things that have improved over the years, including our surgical techniques, our different chemotherapies that we use, but a big contributor has been early identification of cancers that have been silent, and that's been through colonoscopy.
And we encourage women particularly. Women are used to the fact that they have pregnancy, they have hemorrhoids after pregnancy. They may ignore it. Their primary care doc may just hand them some cream. But if you have bleeding that is persistent, you need to get checked. We find polyps, we find masses, we find cancers, even in folks in their 30s and 40s.
And I would imagine women are probably the gender that does colonoscopy least, because they figure that they take care of the bikini pieces. They do the mammograms, they do the pap smear, and they feel like they've checked everything out, and the colonoscopy is one of the last things that they even think about doing.
Well, over and over again, and one of the reasons that we both really wanted to sit with you about this, people don't understand that a colonoscopy is not just diagnostic, it is truly preventative. We see a polyp, we remove that polyp, you do not get a cancer from that polyp. And every day in my office, I have patients saying, really? I didn't know that. I would have gotten this done sooner.
Wow. That's pretty simple. And, you were sharing statistics before, Dr. Taffy. 65% survive 5 years or more.
So that is correct, and that really is all comers. In other words, patients that come in with the early cancers and those that come in with very advanced aggressive cancers. And so if you put that in context, patients that have early cancers, which are the ones that we're kind of aiming for with colonoscopy, those really have a much higher survival, because at that point the amount of spread of the cancer beyond the bowel is significantly less. And so therefore the chances of curing them with surgery are much higher. I mean, we're talking in excess of 90%. And so that's why, again, identifying these early does make a difference.
And what I'm hearing is 1 in 3 may have symptoms. It's a silent thing,
right.
And that's the only way is that's the gold standard, right?
Exactly. It breaks my heart every time a patient walks in with a cancer. I feel that somewhere along the way, we in the medical community have failed them, because we could have prevented that if we had just scoped them maybe 5 years before. And we were talking before the show how a lot of insurances are telling patients you don't need a colonoscopy after age 75. And if you are in good health in general, we do continue to do screening colonoscopies up until age 80. Because if you are generally healthy at 75, you are going to live statistically for another 10 years. Dr. Taffy was just sharing, that he's seen an increase in folks in their early 80s with bad cancers, that if we had continued to do colonoscopies in their 70s, we would have prevented.
And it's not that difficult a procedure. From beginning to end, how long does it take?
The actual procedure itself, 20 to 30 minutes.
20 to 30 minutes, that's it.
And people sleep like a baby.
And when
best nap you'll ever have, I tell them.
And when I went in, I got a chance, if I remember correctly, had that Michael Jackson drug, the propofol.
Yep.
And I got to tell you, I mean, I went out. I mean, I think I got to number 9. Count back from 10, 10, 9, boom. And then next thing I woke up, and the clarity I had, I wasn't groggy. I didn't have nausea or anything like people are accustomed to having when they have anesthesia.
Yeah.
Yeah, what I often share with my patients is that really, once they make it to having the colonoscopy the morning of, when we are discussing it right before they go back, that really, they've probably gone through the hardest portion of the entire procedure, which is getting the prep done. Because really, from that point onwards, it's fairly, it's a fairly rapid sequence of events where they would have the procedure done. As you said, you don't remember much of the actual procedure itself, and then when you wake up, it's time to go home and get some rest and get a nice meal in on the way home.
Get that guilt-free milkshake or banana cream pie that you've been wanting.
Right. and you might have a little excess gas, but so be it, right? I mean, it's better than the alternative, right?
Right.
Yeah.
It really is.
Absolutely.
You know, we were given stats before, and we know that it's the number 2 leading cause of death from cancers. And I'm looking at a statistic here where it is the number 2. I mean, estimated deaths in 2017 from lung and bronchial cancer is 155, almost 156,000. Second is colorectal cancer, is 50,000 plus. But when you look at the estimated new cases, colorectal cancer is number 4.
Right.
So the others are very curable.
Right.
But the fact is that, like you both said, it's too late once you've gotten that diagnosis. And doing the gold standard and preventing it up front is the only way to go.
Right.
Yep.
Right.
The only way to go. So what else do we want to talk about relative to screening and prevention? We talked about it the very first segment. We talked about diet. And we talked about, the fact that I could have 1 or 2 servings of bacon a month. But what else can we do to, maintain our health? Exercise has got to be one of them, right? I mean, eating a balanced diet's another.
So I guess to add to the diet first, raising or increasing fiber intake has been something that's been associated with a lower risk of colorectal cancer. Increasing the amount of vegetables and fruits in one diet, again, because of the antioxidant effect. And then specific to what you mentioned, lifestyle changes. So exercise is positive because it lowers obesity, because obesity has been associated with increased risk. Lowering, or should I say other associations, should I say, include cigarette smoking as an association as well. And then, as mentioned, identification of polyps are really the important modifying strategies that can be used to reduce the risk of cancer.
No, all really good points, and I'm glad you brought up smoking, because smoking is just horrible for everything. But it does, it does have an adverse effect on somebody's colon if you're a smoker too. So
Absolutely.
A healthy lifestyle. It's crazy. We're down 2 segments, and we're just really getting started. I can't wait to get back. I want to talk a little bit more about these polyps. We talked a little bit about foods, and then let's talk about how we can prevent this going on and really getting the message out there, because that's the most important thing. We got to get that message out there.
Exactly.
It's halftime here at Health Futures. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and we are on our 3rd segment. It is hard to believe that we're down 2 already. We are talking to 2 fine doctors from Arizona Associated Surgeons. If you need to reach out to them, you can reach them at 602-993-2622. I've got Dr. Adrienne Forstner Barthel. We call her Ariel. And I've also got Dr. Tafazwa Makarawu, and we're calling him Dr. Taffy, or Taffy for short. But I wanted, now that I mentioned your names, and I also mentioned what practice you guys are with, Arizona Associated Surgeons, and how to reach you, I'd like our listening audience to learn a little bit about who is here in the studio with me. And I'm going to have ladies go first. Is that okay, Taffy?
Absolutely, that's totally fine.
Okay, so Ariel, tell us a little bit about yourself. Where you're from? How'd you get into this specialty?
Sure.
Et cetera, et cetera.
Yeah, so I'm from Northern California. I did medical school at Mother Mayo up in Minnesota. Did general surgery here in town.
Mother Mayo.
Mother Mayo, we call it.
Okay, Rochester,
Minnesota. And then did general surgery here at Mayo Scottsdale, and then was out at Orlando with a group in private practice in affiliation with MD Anderson to do my colorectal training, and came back here. And patients ask me every day how I got into this, and I said, well, that day in medical school, I overslept, and the only thing left behind was the anus, so I became a colorectal surgeon. But honestly, I love the challenge. I love the fact that I can do prevention. I love the fact that I can do education for nutrition and general health. I can do as we call both guts and butts. I do robotic and laparoscopic big bowel resections for folks unfortunate enough to need that, and then also help with things that are small, like hemorrhoid-related issues as well. But it's an amazing field to be in because there's so many things that intersect in it, and it keeps my mind energized.
No, I love it. And the thing I love about you, Ariel, is that you are so passionate about what you do. It just radiates from you. You really love what you're doing.
I do. I love it dawn to dusk.
There you go. So, Dr. Taffy, tell me a little bit about you. You speak a little bit of the Queen's English, so I take it that you're not from Arizona.
No, no, I'm not. I'm actually very new to the Valley, too. But I am of Zimbabwean heritage, but I grew up and was born in England. I spent some of my time in my teenage years in Zimbabwe, but then was in university in the University of Birmingham, and from that point onwards, I spent most of my training years in Birmingham. I guess from that point onwards, I was lucky enough to work with some of the giants in the specialty of colorectal surgery, so that's where my interest kind of stemmed from. And when I'd done part of my training, I then came out to the United States, and I've been where I had some training in Michigan before completing my fellowship training at one of the top institutions in colorectal surgery, particularly robotics, which is in Seattle. And then as of the fall, I've been out here in the Valley.
So you're new.
So
since the fall, you haven't really made it a summer?
So I haven't experienced Arizona summer yet.
How hot does it get in Zimbabwe?
It's actually said to be the perfect weather in terms of how hot it gets. It's fairly temperate as a climate, so I think
it's like San Diego, right?
So yeah, it never gets too hot, never gets too cold. So as I said, this will be my first experience of a scorching hot summer in Arizona. So we'll see how that goes.
Yeah, well, you know what? They got a great thing called air conditioning. So thank goodness for that invention, right? Well, listen, I love having you guys here on the show, and I love being able to give to our listening audience this message, because the overwhelming message is this is preventable. It's an awareness month, colorectal cancer awareness month, and if there's anything our listening audience should take away from this is if you haven't been screened, go ahead and schedule an appointment to get screened, because if you get screened, you could get a 5-year exemption from being screened again, or you could be lucky like my wife Susie and get 10 years. And if you're unfortunate to have a little something going on there, they're able to take care of it right there on the spot.
Exactly.
So that is the overwhelming message that we want our listening audience to understand. I want to ask this question is, what practical methods can be used to lower one's risk? We talked a little bit about it in the second segment, but if you both, one of you or both of you, can share with us, what are some of the practical methods?
I think that a very important aspect of increasing one's fiber intake really is down to picking and choosing foods that you like. I think that if any lifestyle change, I think that if it's foods that don't agree with you, you're unlikely to maintain it. So I often talk to patients about particular foods that are high in fibers, such as different types of fruits, such as blackberries, blueberries. Prunes are a very good source of fiber. I think in general, any kind of fruit that is in its unprocessed form is going to increase your fiber intake dramatically. We keep harping on about fiber, but the recommended amount of fiber or the healthy amount of fiber is about 25 grams a day. And I can tell you that the average amount that most people get is about 5 grams.
Wow.
So what makes...
Do you hear that? 25 is what is recommended, and most people get only 5.
That's what's ideal.
We have a heavily processed diet here in America. And so we have a lot of easy access to food, but the food's not high in fiber.
So to counter that really is to really focus on making a conscious effort to increase fiber through vegetables and fruit that you increase. And that can be done through, as we discussed a few moments ago, simple measures such as putting it in fruits and shakes that you can blend first thing in the morning. That immediately gives you a big boost of the fiber that you need. Nice. And then beyond that, if you're like myself and you struggle with getting the fiber that you need through diet alone, then taking fiber supplements, which there are a number of them out there that are commercially available, which give you that extra boost. Personally, I take the Metamucil, which is just essentially comes in a powder form and comes as a scoop that you take first thing in the morning with 8 ounces of water, and that really can be prepared in a matter of 30 seconds, but that immediately gives you a big, reasonable boost of fiber without much effort.
And for me, I use Citracel. I get that from Costco. Use 2 caplets a day.
Yeah, they even have fiber gummies. They have gummy everything these days.
They do.
For my patients who they don't like to mix things up, they want to grab something on the go, they love the fiber gummies. But to what Dr. Taffy was saying, the invention of the NutriBullet or the Ninja or whatever it is the latest thing has been helpful on 2 fronts. One, I know that I can literally put anything into that smoothie and my husband will eat it because it tastes good. And I can pack it full of all kinds of antioxidants and all kinds of fiber. And in addition, as a meal replacement, it helps my patients who are struggling with weight loss. And we do know that if you are quite overweight, that is a risk factor for all cancers, not just colorectal cancer as well.
And, one of the things that, I know you subscribe to is the exercise piece. And trust me, we're not telling you, our listening audience, that you need to go join the gym. But you know what? These evenings are really nice. Mm-hmm. Go take your partner, your spouse, your children, your dog for a walk, right? I mean,
exactly.
30-minute walk is a good preventative measure, right?
Yeah, just walk that subdivision, walk your dog, walk your children, walk your spouse, let your spouse or partner walk you.
Just don't use a leash.
Right.
Yeah. Only on your dog.
Right.
Well, you're listening to Health Futures Taking Stock in You. We're down our 3rd segment. We got one more to go. I want to talk about in the very final segment about eliminations and what to expect and those sorts of things, if you would. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and thank you, Wes, for bringing a little Chicago into our Friday. Love that. Only the beginning, and unfortunately, this is going to be really the end of our show. We're in our 4th segment, and we're talking about Colorectal Cancer Awareness Month. It is March. We're in smack dab in the middle of it, and I want our listening audience to take action. If you haven't been screened, go and get screened. We talked about a lot of things in the first 3 segments, and one of the things I want to talk about now, and I teed it up at the very end of the 3rd segment, is eliminations, bowel movements. And that is really a sign for maybe some concern, if you would. And, we all should be checking our bowel movements. And we should be looking in the bowl to be looking for bleeding, you mentioned earlier. Mm-hmm. Black stools typically means you have blood in your colon, right?
It usually means that unless you're on iron supplements, because that'll give you black stools. But
right.
That can also be
some kind of bleeding.
Of bleeding in there.
Could be gut bleeding. Could be a lot of other bleeding going on.
Yeah.
What else should we be looking for?
Well, I think it's important to make sure that the stools that you are able to eliminate regularly. There are a lot of people that struggle with regularity. whether it's having severe diarrhea or having very, very hard stools. Some of that is adding fiber, which we touched on before. The other is that anytime we take antibiotics or undergo any kind of other stressful surgery or procedure, we can end up killing off a lot of our healthy, what I call gut bugs or gut flora, which we now know from studies that have been published are important at maintaining our immune system, maybe even preventing some adult onset diabetes. And so the role of probiotics, which we always advise refrigerated ones if you want to do a medical grade.
Right.
You can pick those up, Sprouts, Whole Foods, health food store, as long as they're refrigerated. I think even Sam's Club and the Costco selling them now too. But those can help keep those bowel movements nice and regular, and that's important because a big change in those could signify something going on in your colon that we need to take a look at.
I want you guys both to talk to us about cleanses. I mean, where do you guys stand on that? Because I hear so many people are wanting to do these colon cleanses, and they feel like, they do a colon cleanse and then they fast for a little while. I mean, they feel like that they're healthier and better. And you brought up a really good point. I mean, there are some bugs that are in there that are good bugs. And you cleanse it, you're getting rid of everything, right?
Yeah, I always joke that I get a huge uptick in hemorrhoid patients right after the first of the month when everybody's doing a bunch of cleanses. I advise if you feel healthier doing a cleanse, it doesn't bother me if you do it, but you don't need to do a cleanse in order to have a healthy gut. You need to do high fiber, you need to do healthy fruits and vegetables for all the benefits that Dr. Taffy was talking about. And if you are doing the high fiber, you will clean out or cleanse your gut that way.
Perfect. Absolutely perfect. So we talked about cleanses. Now, there are some screening alternatives that we hear promoted. I wanted you guys to, give us some myths and truths on those things. Talk to me about some of these other screening alternatives other than the gold standard colonoscopy.
Quite. So what often you may hear about, or one may hear about either through speaking with colleagues or I guess with the advent of the internet, there's a lot of information that's out there, are alternatives to colonoscopy, which include X-ray tests, which are barium type tests, which look for the presence of cancers. They're also, even more simpler than that, tests that involve sending in a stool sample, which look either for the presence of blood or other tests that look for the presence of genetic abnormalities within the stool that may signify cancer. I know that also with advertising that these types of tests are becoming more prominent. What I will say is that a lot of these are useful adjuncts to colonoscopy, particularly the stool tests, because if they are positive, may encourage one to proceed with colonoscopy. And a lot of times when patients don't feel comfortable with it, they often go to that first. What I will say is that they are not an adequate substitute. In other words, using that alone as a screening test is not recommended. A lot of the time as well with some of these commercially available products, they actually sometimes over-predict the presence of a cancer. So again, may add to unnecessary concern or anxiety. And so I think that as a test, I think that they're really useful to us in terms of adding additional information, but on their own, I don't think they're actually adequate. One thing that we do know is that the detection of polyps with these tests is again, suboptimal in comparison to colonoscopy,
Exactly.
Which is the key issue here. That not being able to pick up the polyps and remove them is really a big factor that separates colonoscopy from some of these other tests.
Yeah, and some of these newer tests are really to try to tell a patient, do they have cancer? But as we have talked on several segments, if we're at cancer, we have really missed and failed the patient.
Right.
We need to be intervening and getting these polyps out before that. So I don't want a test that tells me that I have cancer. I want a test that gets rid of my polyps.
No doubt, no doubt. Talking about polyps, if you don't have a colonoscopy, can polyps grow and then go away on their own?
No.
So, I mean, if anyone's telling you, don't worry about it, they don't have this test, they can go away. They won't go away unless there's an intervention by a surgeon like yourselves.
Yeah, that's certainly a misconception that I guess some people have thought maybe that with polyps that they may fall off with bowel movements, or that they may go away over time.
Exactly.
With modifying one's lifestyle changes. But in actual fact, once you develop them over time, essentially all a polyp is, and I don't think we really touched on this as yet, but all a polyp is, just simplifying, is just abnormal growth or disorganized growth of the lining of the bowel. And for the vast majority, thankfully, if caught early enough, most of them are harmless. But if left over time, that disorganized growth of the cells over time may eventually become a cancer. So, and they never just fall off. So that's something that needs to be removed endoscopically.
They look like little skin tags to us,
right?
And the colon is their happy place. So they will live and they will grow and they will grow and they will grow, and then you'll have something bad, which we don't want you to have.
Exactly. So I know we're winding down our final segment in our show. Both of you guys mentioned robotics. Technology's here. Tell me a little bit about what's going on with robotics. We probably have about 2 minutes left.
Sure. The Da Vinci system is the most popular system right now in the United States, present at all of the hospitals in town. And it's just an amazing way to be able to do what we call minimally invasive surgery, which before was just laparoscopic, or what people think of as orthoscopic in the orthopedic world. But it allows us to actually operate using 3D vision, get a much more precise view, a much more delicate handling of the tissue, and to have a minimally invasive surgery where patients go home even faster because of the very delicate handling that's through this interface that we affectionately call the robot. But it's not wake up in the morning and say, "Hi, robot, go remove that person's right colon," and then they come back to you. You are there. You're at sitting at what we call a console. You are, every movement you make is being mimicked by this device that's actually inside the patient.
Wow. It's kind of like science fiction, right?
Yeah, no, it's a wonderful technology, and really it's growing in leaps and bounds, particularly in our field of colorectal surgery. And I think that as the new versions of it continue to develop, I think that really the boundaries that we are able to use it for will continue to grow. So, or at least the depth of procedures we can perform will definitely be more variable. So I think that I was very fortunate enough to work in a place where the surgeons are very passionate about its use, and I think that's going to make a very big difference in the future.
Well, I got to tell you, Dr. Taffy, Dr. Ariel, thank you so much for being on the show. To you, my listening audience, if you haven't been screened, take the message that we delivered you here today very serious. Go make an appointment. Go get a colonoscopy. If you want to talk to any one of these fine surgeons, you can reach them at 602-993-2622, Arizona Associated Surgeons. I can't thank you both enough. This is a very important topic.
Thank you for having us.
It's our pleasure.
This is something completely preventable. Wes, have you had yours done yet? All right, well, you can meet with these doctors when we're done here, okay? You've been listening to Health Futures Taking Stock in You. It is March, and it is Colorectal Cancer Awareness Month. Thank you for joining us today. Make it a great day. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.